Inside the stockroom of this medical supply company in Sydney, orders are flooding in faster than they can be filled. Until recently, this business mostly sold first aid kits, while other products such as face masks gathered dust.
For the masks, they were sitting on our MediBC site. It's been up for about 3 years now, and we literally have not sold any masks until end of January, and that's when we were just flooded with orders that came through.
It was at the height of the outbreak in Wuhan when MediBC was swamped with requests for face masks. Owner Michael Randall says some of the orders were clearly suspicious, with buyers using fake credit cards and email addresses to keep their identity a secret.
It seemed like we were being targeted by some crime syndicate because there were 10 orders through with email addresses that looked extremely weird.
730 has traced the delivery of 20 boxes of masks here to this address in Melbourne's southeastern suburbs. Property records reveal the female owner of this home used to run an import-export company.
Hello?
But the mobile number attached to the order,
I'm just wondering, do you know anything about that?
No,
was answered by a man who says he knows nothing about the masks or why his number was used.
Some idiot put my phone number as a contact number.
Invoices and email addresses reviewed by 730 suggest up to 8 bulk orders were all placed by a single mysterious party.
It would be nice to find out what happened to it and where it went, and for the police to knock on the door and see what's happening.
Michael Randall has told 730 he was interviewed by the Australian Federal Police yesterday. It comes as the federal government ramps up efforts to stop hoarding and profiteering from essential medical supplies. In the past few weeks, Border Force has seized more than 69,000 masks bound for overseas. Recently, the spotlight has been on Chinese Australian groups and companies which sent plane loads of masks and gowns back to China weeks before the virus sparked emergency measures here. While some exporters have been accused of profiting from the pandemic, many say their actions were charitable. What's not in doubt is that frontline health workers are exposed.
Out of sheer desperation, we've gone to Bunnings, we've gone to Mitre 10.
GP Alvin Chua runs an outdoor flu clinic at his practice in Adelaide. He's been relying on hardware stores for his protective gear because he says the federal government isn't providing him enough masks from the national stockpile.
We're getting a box of 50 every 2 or 3 weeks to be shared amongst 8 to 10 doctors at each surgery, and that's really not enough to get us through it.
GP clinics in Adelaide are now so low on stock that Dr Chua has resorted to sourcing a mass supply of protective gear direct from China.
22 practices here in South Australia have grouped together and placed a large order for masks, gowns, goggles, and as well as hand sanitizers from overseas.
It's a huge gamble though, with the order totalling $114,000 and no guarantees the equipment will be up to scratch.
I would simply urge people to be very cautious and make sure that they verify the reality of the supplier, and if people were to import and they needed to test, then we would make the CSIRO available to ensure that the quality was being maintained.
Today, the federal government announced it's stepping up its protection of healthcare workers with the delivery of more supplies.
Well, I can confirm that we've just today made available an additional 11 million masks for the medical community in Australia, and that includes 2.3 million for primary care. We are making over 5 million available in the coming weeks for GPs in Australia.
Sourcing quality protective equipment remains an issue for governments around the world, and it's growing by the day, with hundreds of new or repurposed Chinese factories offering to supply Australian importers.
We're probably getting 10 or 15 or 20 emails a day. I've lost count, saying we've got N95 masks available, we've got shields.
Many of the Chinese companies contacting MediBC aren't even registered and have no experience at all in manufacturing medical masks. Instead, they specialise in wine accessories, gifts and souvenirs.
So almost like everyone's jumped on the bandwagon.
Chinese-owned retailer Miniso is fortunate to still have a steady supply of stock being delivered to its Australian stores. In Melbourne, it's donated 40,000 face masks to disability services, a decision the company says has nothing to do with politics.
I believe some people will think in this way, or we're probably just doing the right thing. Yeah.
Technology is emerging as a potential saviour in the fight to protect our frontline health workers. The University of Queensland has been asked by the state government to fire up its 3D printers to make face shields for hospitals.
So this is actually just a frame for the face mask. So that would sit on your head, and clipped to the front would be clear plastic. That stops particulates in the air from getting onto the faces of health workers.
The uni is one of a dozen organisations that have 3D printed over 3,000 face shields in just 5 days, proving once again how science and technology are helping the world get through this crisis.
We've only been printing these since mid-last week when the request came through, so the first batch was delivered on Friday. So yeah, we're just going to continue to supply until they stop asking.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.